त्रिजिल सर को ज्वाइन करना बोल। Good morning, sir.
Good morning, sir. Good morning, sir.
Good morning, all.
Good morning,
Good
sir.
morning, sir.
Where you are sitting inside the classroom or in your respective places?
In the conference hall.
Okay. So I can interact with each one, or I will be there. So interaction will be possible, or it is a one-side talk?
It will be possible, sir.
Because I am getting some echo there. Okay. I think 12 participants. But full, you are there, full members. Can I show you once? Anyone open?
Sir,
Okay. I think better now. One or two members open their cameras, it will be good. Otherwise, I feel like I am talking in an empty audience. Rahul, one or two members now, or any one or two members, they can open their mobiles, means I can see. Okay. Is my slide is visible?
yes, sir.
Yes.
Okay. So tell me the basic, like that. What is studied about the Ayurvedic Ayurvedic anatomy part. So basically, in our interactions, I already told Ayurveda Rajana Sharira is something different, like normal anatomy. So in normal anatomy, there are fully structural entity we can see. But in our Rajana Sharira, they are mainly concentrating on the functional entity. So when you are studying one structure in Rajana Sharira and you are trying to correlate the same structure with the modern anatomy, it is something difficult. So in Ayurvedic anatomy, more focusing on the functional aspect rather than the structural thing. I think we studied in the Susro Samhita Sharirasthana 5th. नाम क्या है इसका? Sharirasthana 5th Susro Samhita Sankhya Sharir. So while dealing with the Sankhya Sharir, you can see the structure is explained in Ayurveda, Susruta Acharya, like asti, sandhi, peshi, sira, snayu, dhamani, like that elaborate description is there. When we try into these structures with our modern system or with our present body parts, it is very difficult to correlate. So that's I told, don't try to correlate these structures with our present anatomy. So you study Ayurvedic anatomy separately with its functional aspect and study modern anatomy thoroughly according to the elaborated modern descriptions. Got my point? So whatever the structure is, sometimes if you are trying to, if you see the Snayu in lot of clinical conditions, but in modern, when you are going to correlate this clinical condition, you will say directly it is sometimes related with some nervous. Sometimes you can see it is related with some tendons. Sometimes you can relate it with some ligaments. And basically, Ayurveda also is like that. Description is like that. Vada, Pitta, Kapha, Tridosha. Then Malas are explained. Then Dhadus are explained. So basic concept, all these are the Panchamahabhuta structure. So in different time, we are giving the different name. When it is going to Poshna, Pushti, we call it as Dhatu. When it is giving its a Mala part, we call it as Mala. So same like in structural anatomy, also same feeling. When you nomenclature the arterial name, area-wise we are giving the nomenclature. Okay, same like functional-wise we are giving the nomenclature. So you try to understand the Ayurvedic concepts rather than correlating. Okay, this is my first point. Don't try to correlate these structures with purely in the modern picture. So already, I think Gairo sir last time completed some Asti Sandhi completed. See, what's are completed in the last areas? Sandhi Sharira completed, Asti Sharira completed, I think. Anyone? Asti Sharira completed, no? Sandhi Sharira also completed. I'm not hearing. Asti Sharira or Sandhi Sharira completed?
Yes, sir.
Yes, sir. Yes, sir.
So I think any one or two members can unmute their speakers. Then it is very easy. I can get that what is the reaction from your side. Okay. Then without delay, we will start our topic, Snayu. So in Snayu, Delkhana defines Snayu as a subsidiary tissue having the shape of a jute used for binding bows. That means it is a sewing-like materials. So that's why in Ashtanga Sangraha, Snayu mentioned as the sewing material in surgery. Abhi dekho, this sewing material means it is a fibrous-like structure. The structure is having strong. So that is why this term is used in Dalkhana. It is a secondary to subsidiary tissue of a shape of a jute. And the term Snayu derived from the root snadi, which means dry. So that means when you go through the dissection also, these structures will dry very fast. Like tendon, ligaments, all will be structures dry very fast. And according to Sharangada Samhita, Snayu, Snayada are binding materials of muscles, bone, and fat. This is a binding material. So while going through this, we can see it is a type of structure or rope-like structure or any type of sewing material-like structure, that binding between the structures like Asti, Sandhi, and Meda. In this Loka Susra Samhita Sutrasthana, Shanaja Shauma Sutrabhyam. Snayavaha, Balena, Vapunaha. That means it is having like na bala. Bala means like hair-like structure. It is a hairy structure, hairy-like structure seen in our body. And already I told in the Dalkana commentary, it is Shanakara Upadadu Visheshana. So it is noted when the ligaments or structures, while it is a like white structure, again some we call it an aponeurosis like tissues. The word is like aponeurosis. That means it is binding from the muscles with the bones. That is a large area muscles. So that is also white in color. So in the concept of Susruta, these are the string-like fibrous structure, and it is a Ubadadu variety. And it's a developing from the essence of the Medas. I think you studied this in the essence of the Medas, like Medas having two parts. One is Sira Bhava, another one is Snayu. When it's getting Karatva, it becomes Snayu. That is, Snayus are the hairy skin, thin network, disappearance and minute, and are difficult to locate with the naked eye. This is another reference like. So that is some of the structures are the hairy structure, network like it's minute in body, and location also sometimes difficult. And Delhan again telling what is Kandara, word Kandara. So Kandara is the Mahasnayu. Mahasnayu is Kandara. Same in Charagasamid also. Kandara is Snula Snayoga. Kandara is Snula Snayu. Stula Snayu is Kandara. These are some references related to this. As per Kashiva Samhita, this is very important. In Kashiva Samhita, there are Nava Snayu Shadani. That means 900 Snayus are explained. But the last end is very, very interesting. Mastulanga Mulani. So it is Mastulanga Mulani. So that means it is emerging from the brain area. Mastulanga Mulani. So brain area we have the neurological part, nerve systems. So that means the Snayus are correlating with the nervous system in our part, the central nervous system. That is originating from the Mastulanga. So that's why I feel like in Snayu Roga Vibhaga, it's a neurology. Also in some Hindi translation, we can see the Snayu Roga Vibhaga is the neurology department. So that means Snayus are originating from the Mastulanga Mulani. So sometimes na question will be there how you can correlate with the Snayu with the nerves. So as per the Kashiva Samhita, we'll get the reference like Navasnayu Sadani, Mastulanga Mulani. So these are emerging or originating from the brain. So we discussed the similes like it is Shanakara, Ubadatu Vishesha. As per the Dalkana, it is in Susruta Samhita Sutrasthana. And it's a shape of the jute or binding material. And as per the Ashtanga Sangraha, also it is mentioning that it is a sutra, and in Sharanga Samhita, Snayus differentiate like it is binding material, bandhana, it is giving binding, dehe, mamsa, asti, medasa. Mamsa, asti, and medas. These are binding between these structures Snayus using. So coming to the types, this is very important because in your NCSM syllabus part, that you can see the question paper is in the 3 parts. Like one is MCQ based, second one is the SAQ based, and another one is the long question, LAQ. So main chance of the question in this area is one short answer SAQ, that means for 5 mark, and second one is the MCQ. So 10 mark question in this area is very rare chance. But studying in concentrating for the 5 marks and the MCQ part. So 5 mark, one important question like what is the type of snayus? So snayus are divided into Chaturvida. Chaturvida means 4 types. What are the 4 types? That is Pradhanavati, Vritta, Prithu, or Prithula, Sushila. These are the 4 types of Snayu. Snayus Chaturvida, 4 types. So Pradhanavati, it is located in the Shaga. Shaga means extremities. Pradhanavatyaha Shagasu. Sarva Sandishu. That means in the Shaga Sarva Sandhi, the joints in the extremities. So Pradhanavati is situated, spreading ligaments in the extremities. So sometimes we can aponeurosis part also we can see this Pradhanavati. Basically, what is aponeurosis? It is a sheet-like structure. It's a white fibrous tissue that connecting between the tendon in flat muscles, and it's a wider attachment. That is aponeurotic. So Pradhanavati mainly seen in the Sarvasandhi. Sarvasandhi Suchadasti. And already I told Kandara. Kandara is a Mahasnayu is called Kandara. Previously, Mahasnayu. So Mahasnayu, that is a Vritta type of Snayus. Round cylindrical ligaments we call it as Vritta Snayu. Round and cylindrical. And third one is Sushira. So word meaning Sushira like there is a foramen of spinges. And it is seen in the Ama Pakwasya Andeshu. That means end of the Amasya, end of the Pakwasya. Where we can see the spinges also we can correlate with the Sushira type of Snayu. And Prithula type of Snayu seen in Parshva and Urasi. So these are the 4 types of Snayu present in our body. So they are 4 types: Pradhanavati, Vritta, Sushira, and Prithula. And these 4 types are located in If it is a Pradhanavati, it is located in the Sandhis. And it is in the Vritta, it is the round structures. That's why called Kandara. The word you can see the Kandara. And Dalhana Kandara is called Mahasnayu. Mahasnayu is Kandara according to Dalhana. That is also important. That is Kandara is the Sthula Snayu. Again, Kandara is a Sthula. Sthula means bigger. Sthula Snayu. Prudula is a thicker. So Prudula is situated in the Parshva and Urus. So these are the 4 types of classification of Snayu. Again, we can see the description in the Susra Samhita. Already told 900 types of Snayu. Navashatani, 900. And in that, Tasam Shagasu. Shagastu means in the Shaga. There are 600 Snayus are mentioned. Koshta. Koshta or Madhyashira. Dveshade Trimsha. Dveshade Trimsha means 230. And Griva Pratyurdam. There are Saptadi, 70. Grivopuri means above the neck region. So these 900 Snayus are divided in this way, like Shaga 600, Koshta or Madhyam area 230, and Griva Upari 70. Now we calculate 600 plus 230 plus 70. Then again we can get a deep description of Shaga located in particular this area, like in how many Shagas, how it is divided into Shagas. In Koshta 230 explain where it is located in Koshta. And in Griva how we can count it the 70 types of Snayu. Got my point? They got total types 4 types hai. And total number kitna hai? 900 hai. Then 900 how it is divided into? So basically division is Shaga and Koshta and Shiro Griva Urda. So total 900 is divided into Shaga 600, Koshta or Madhyasharara 230 and Griva Ubri 70. Okay. Then how we got the 600? In 600, Ekekasyam tu Padangulyam. That means each fingers having 6. So total 30. Each fingers having 6 Snayu. 5 fingers. So 6 into 5, total 30 Snayu is in the one limb. And metatarsal and angle area, there are again another 30. Jankhayam, Jankha, 30. Jankha, forearm, thigh, all area, 30. Janu, that means knee joint. Thigh region, again 40. Axillary region, 10. That is one extremity, you can see that in axillary region 10, then thigh region 40, knee region 10, forearm 30, metatarsal and ankles division is 30, each finger 6. That means total counting in the one limb we will get 150 snayus. So total 4 limbs, that means 150 into 4, that is 600. This is the deeper division. So you understand like that, Ajar is explaining the, Ajar is giving one number and Ajar is explaining the, each structure is situated in particular area. In the Kaddi, I mean the 230 is divides into lower back. So in the Kadya region, 60 is explained. Prishta region, 80. Parshva or flanks region, 60. Uras or chest region, 30. So total Madhya Sharira is 230. Kadya, Prishta, Parshva, Uras. Kadya 60, Prishta 80, and Parshva 60, Uras 30. And grieve ovary. Grieve ovary above the neck region or neck region, Griva, yeah. 36 in Griva region. And in the Murdani region, that is the head region, that is 34. So total 36 plus 34. So counting this all, you will get this one like Shaga 600, Madhya Sharira 230, and Grieve ovary 70. See this one, how it is a division. This is the Madhya Sharira. $60, $80, $60, $30. And in the above the neck region, head region 36 plus 34. So total 900 snayus. So therefore, already I told you, it is connected between the Asti, Mamsa and Medas. You can see one picture like a wooden plate is the individual plates, and it is connected between these threads. So they can hold the weight, heavy weight. So like that simile Sajar explained, the Bharat Shamada Dekhina. It's an important question is the Bharat Saha Nara. How in the human being can get the weight bearing all because of the Snayu. So it is a simile explained by the Acharya that is analogous of the boat capable of the bearing weight or bearing the capacity of bearing the weight, that it is the tying together between the wooden planks. So you understand like that how this Snayu is arranged in the body. Because of this one, we can Bharat Shamada of the body or weight bearing or will come. Again, this is another important like that. So compared to other structures like bone, muscle, joint, if an injury to the ligaments, healing process is delayed. अब देखो meniscal tear है, anterior cruciate ligament tear है, in relation with the knee joint, the healing process is delayed. So that is why it is cause a permanent deformity chance. So Snayu is a structure like if an injury happens and there is a chance of permanent disability. And the wear and tear cause the serious types of injuries. So it is compared to bones and muscles and joints. These injuries are severe. So this is also Ajaris explained. And Ajaris explained one more thing like why we are studying to anatomy. Why we are thoroughly studying anatomy too. We need to a upper hand in the surgical practice. So Shalya Tantrartham, we are studying anatomy properly for the surgical measures. So Ajaris explained the Guda Shalya. Dekho. Guda Shalya means some structures are inside the body and not seen or not visible by externally. So good clinicians can search it inside. Maybe a gunshot, some particle go inside, or any glass piece injury, some particle goes inside. So those surgeons, they have a good knowledge in the structure entity inside the muscle, inside the asti. He can search the structure and he can remove it properly. That means Guda Shalya Aharanartham. So Snayu is important, or who know the Snayu very well, then only that surgeon can remove the structure or any foreign particle inside the body. The knowledge of this ligaments, tendons is important, or nerves is important to extract the foreign material inside the body. This is highlighting in this area. So in one word, one question is the Guda Shalya Maharana. The knowledge is essential. Dash knowledge is essential, like Sira knowledge, Asti knowledge, Snayu knowledge, Sandhi knowledge. So Snayu knowledge is essential to Guda Shalya Udaharanattam. That means the foreign body deeper to the. So another description is there in the Charanga Samhita. Previously we called the Mahasnayu Skandara. So again, Ajaris Charanga explain Prasarana Agunjanyoho Anganam Kandaramata. Prasarana Agunjana means flexion and extension of the body. We need the or help of the Kandara. I mean, either indirect about how flexion and extension is possible. Flexion extension is possible because of the nerve impulse. So in this again we can indirect link like Snayu can correlate with the nerves. So that's why I'm telling, if you are studying, don't confuse like in almost all books, Snayu will be the tendon or ligament. And now you will see, now Sari is telling Snayu is a nerve. So how we are telling this now? We are getting the piece of information in the some area like Prasarana Agunjana, flexion extension, contra is needed. So Prasarana Agunjana, we need the nerve supply. We need the nerve. And according to Kashya Samhita, again Acharya is explained, Snayus are deriving from the Mastulangam Mulani. That is the Mastulangam Mulani is the nerve system. So in these references, we can tell that Snayu is a part of nerve. Okay, getting my point. So here is an indirect reference that is telling Prasar Nabudino Hangana Kandaramata. That is a Kandarai section. Now you can see in this area, there are a lot of slogas there. This is all that references related in Susro Samhita Nidhanasthana. In Susro Samhita Nidhanasthana, Acharya is explaining like Antarayama and Bhagirayama, like convulsion disorders. So in the area of the convulsion disorders or spasticity of the body, Acharya is explaining the aggravation of Vada in the Snayu. Aggravation of Vada in the Snayu or Pradhana aponeurosis area. This means the bending or spasticity is the clinically condition due to the nervous issue. Here is an again indirect reference like if there is an Antarayama and the Vada predominance, the patient is getting the convulsions or bending. So that means there is another indirect description related to nerves. The same like Antarayama and Bahirayama, tetanus like convulsions. This is also due to Snayu. Same Susruta stiffness, tremors, or occurs due to the Vada aggravation in the Snayu. This is the neurological indications. But again, Ashtangritya, one more example is like that. I told you last time, sciatica is the. So sciatic nerve is. Okay. So you can see what slogan. Hemiplegia. So hemiplegia, Ekangaroga. We call it as an Ekangaroga. Here also we can Grihitwardam Tanorvayu Sira Snayur Vishesha. Again, Snayu word is there.